phase 1 study of Teclistamab, a humanized BCMA-directed monoclonal antibody that is a bispecific T-cell engager. So it targets BCMA and targets CD3 and redirects CD3 T-cells to BCMA-expressing myeloma cells. And what was presented at ASH was a phase 1 study, so including the dose escalation part. It included a cohort of patients that were treated with intravenous dosing, but ultimately the dose moving forward is going to be given as a subcutaneous dosing. Also, initially patients were treated on an every 2-week schedule, but now ultimately patients have been treated on a weekly schedule. And so what this study encompassed then was advanced refractory myeloma who were intolerant or refractory to the currently established myeloma therapies. One key part of this study was that patients could not have had prior BCMA-directed therapy. And looking at the patients who were treated, they were very reflective of patients with advanced disease. They'd had a median of 6 prior regimens in the entire cohort, and 80% of them were triple-class refractory. So that means refractory to an immunomodulatory agent, refractory to a proteasome inhibitor, and refractory to an anti-CD38 antibody. And in fact, about 39% of them were pentadrug refractory, so really quite a challenging group of patients to treat. I should also note that the oldest patient on the study was 84 years old. The data was presented in 2 groups. One, the total cohort of 149 patients, and then the focus was on the recommended phase 2 dose of 1,500 micrograms sub-Q weekly, and that was a group of right now of 33 patients. So looking across the board, just at the entire group, there was 55% of patients had cytokine release syndrome.